Hello, welcome to The Healthy Enterprise. If you're returning, welcome back. If it's your first time, then thanks for joining us. My guest today is Dr. Paula Muto. She is a general and vascular surgeon out of her clinic, the Muto Vein Center in North Andover, Massachusetts. She is also the founder and president of UberDoc. UberDoc is an online system that provides priority access to the best doctors at an affordable, transparent price. It's designed to help you get the care you need when you need it in just a few clicks. So if you want to learn more about this as badly as I do, then stay tuned. We'll be right back. Welcome, Paula, to this episode, and thank you for joining me today. I'm excited for you to share your journey as a surgeon and also as an entrepreneur, because you've got some interesting things going on. And so let's start with explaining to everybody your background, where you came from, and what you're doing.
Great. Well, first of all, thank you, Heath, for inviting me today. I'm really excited to be here. It's a great podcast. So I am a surgeon. I'm a vascular trained general surgeon. I have come from a long line of surgeons. My dad was a surgeon. My brother's a surgeon. I'm married to a surgeon and two uncles, all in healthcare, all in Massachusetts for a collective century. Wow. So that's who I am. I live outside Boston. Lived here pretty much all my life. I have a couple of kids, and I'm trying to disrupt or rather restore healthcare because I'm very passionate about it.
Amazing. So that's generations of surgeons. Now, are the kids on the same track?
No, I have one who's an engineer and one who's an aspiring actor and producer.
Okay, awesome. So the buck stops there, I guess.
Stops with us.
Okay, so first tell us about Muto Vein Center, because you've been running that company a little bit longer, and then we can get into UberDoc after that.
Sure. So I've been a solo private practice surgeon pretty much my whole career. After I finished my vascular training, I worked very briefly for a group. Had my second child. I had my first child while I was in fellowship. My second child. And then actually kind of came back from maternity leave and lost my job for being gone too long on maternity leave, a 3-month unpaid maternity leave. So yeah, things have changed maybe. So I sort of landed in my dad's office, in inner city Lawrence, which is a poor community outside Boston. He'd been a surgeon there for 20 plus years. And I just landed in my dad's office and I said, okay, I'm going to not work for anyone else again. And so I became a solo private practice doctor almost by necessity at first and by choice soon after. And so it gave me a unique perspective of running a practice, the ins, the outs, the billing, the collecting, everything. So nothing was a mystery to me. So with that, I ran my practice. My husband was with me for a while. Then I sold him to the hospital. He was chief of trauma, chief of surgery. He's sort of got leadership positions. And so then I was always doing vascular, and I began to do ambulatory venous procedures, which was started back in 2005. In 2006, we were one of the first centers. Actually, we were the first center in Massachusetts to become nationally certified. I have a brilliant team around me, a wonderful group of people who've been with me for many years, and we do a good job for our patients. So I built the Vein Center, and I still do general surgery call now. We have lovely residents in both family practice as well as general surgery, and so I really like young people a great deal. And we're just trying to keep the access to care in the community open, to good and high level care.
Okay, you brought up leadership, and you have a great team, and we can't do things on our own. We have to have people with us. So how do you lead a team of people in your organization?
So I always say the best people I never chose, they came to me. I've been an employer for, almost 30 years, right? And there are lots of people and that you've had along the way, and some good, some bad, and most business people will tell you this, right? Who works for you and so forth. You have to know, you learn a lot when you lose an employee and you find out they haven't been doing something. You suddenly learn to do that. The problem with, as a woman entrepreneur, as a woman in charge is that we tend to do everybody's work for them. Like, women's style of leadership is like, oh, my biller wasn't doing that, I'll just do that, and then I'll do that. And then next thing you know, you take on so much responsibility that you're like sort of under, not enough time to do the things that you're actually trained to do at the highest level with the best revenue.
Right.
So how do you do it with leadership? I mean, you take a lot of punches, right? You have to roll with you roll with the punches rather.
Right.
You really have to be flexible, and you have to understand people and what their limitations are. Not everyone is going to understand when you turn on electronic record how it works.
Right.
Not everyone's going to understand, even can put a sequence of 15 numbers into the computer properly and reliably. Right. You have to just know the limitations of the people around you. And then, like I said, the best people grew with me. I had a nurse that was with me for 25 years, and she was an ICU nurse for 40. And she was amazing. She is amazing. She retired. And it's like, she wore the white stockings, the white shoes. She'd wear the hat if she could. And she trained every nurse in the community. It was a true angel. And it was amazing that my patients would meet her in the office and then wake up in the ICU, and there she'd be. Oh, my God, Dr. Muto's nurse is here to take care of me. So I have to say, made my work shine, right? And of course, my dad was a great surgeon with a great reputation. My husband also. Everyone, the ones that everyone show, when you need someone, they go, they show up. So, but that's it. You surround yourself with good people.
That type of dedication too, is that something that is learned, or is that innate in some people? Like, I mean, this nurse that you were referring to, it's like she was on the spot when she needed to be, and do you find that we've lost some of that in our society?
I think so. I think that because there's so much gratification in taking care of someone well, there's so much, and right now our doctors feel so lost because they are either forced to not take care of a patient well, which leads to moral injury, right? And burnout, right? Or they're unable, like they're not connected enough to the patient. At primary care, their patient's really sick. They end up in the hospital, and the hospital takes care of them, right? So at the time of need, at the sickest, they oftentimes don't see their patient, right? And I think that those relationships are forged when the patient's in the most amount of need is the highest amount of trust that they give you. As a surgeon, you're lucky because, you do your work in a hospital, you do in the office, you have a very different relationship with your patients. Sure. But I think that for sure, we've lost a little of it just because of the way we practice medicine today.
And particularly, I guess probably the strains to healthcare too, right? We just don't have the time or the availability or the staff to do.
So my nurse Barbara used to talk about the 70-minute hour, right? Like, in other words, you have 60 minutes, but you got to do 70 minutes worth of tasks. Right. And 90% of them have nothing to do with taking care of the patient. They have to do with, taking care of a documentation or some type of get a medication out of the Pyxis. There's so many steps involved in everything. I have to say that hopefully that will change with AI and some of the technology, that we kind of are returning back to a much more common sense approach, because all that data can be captured in so many more efficient ways than to waste the caregiver's time accumulating it.
Right. What are some of the other challenges that you've overcome over the years during this experience?
You have a long time? No.
How long have we got?
So as experience as a surgeon, I have to say that, as a woman surgeon, there's all sorts of challenges there. The biggest challenge, of course, is is compensation. Women doctors still make 70 to 80% of a man. Even though we do the same thing, right? My husband and I do the same thing, but it's just different. So you have to work a little harder, you have to fight a little harder, and you have to do a little better. Like, your patients, there's not as much wiggle room. So that's why, study after study show that women doctors, especially surgeons, have better outcomes. And I think it's because we can't afford a bad one. Right. And that's it's so weird because 50% of medical students are women. 50% of our surgical training are women, but it sort of doesn't trickle all the way up.
It's hard to believe we're still hearing this, even though it's as public and we're, people are aware that but we hear it, but then we think, oh, well, I'm hearing it. Somebody must be resolving this. And where do you resolve that? How do you resolve
You know what? I think it's economic, Heath, and if you look at the economics of the 80% world, we're still 80%, right? And I think that we tend to be distracted with other things like opportunities and, we're going to give you a promotion and this, but what you really look under the hood, you see that women start at a lower starting salary in every profession, and then they get promoted accordingly, but they start lower. So until you change the boardroom to 30% women, until you get enough women at the top of the heap, but again, if everyone's trying to get there, and it's just harder. So I think those, I don't have all the answers, but I think those, I'm very, very cognizant of making sure people are still aware of that. Now, I'm sort of a maverick, right? I work for myself because I'm not going to work for anybody else, right? And that comes with its pros and cons and its economic challenges as well. And when the economy's good and the reimbursements are good, you're good. When, the costs go up and the reimbursements go down, you're not, right? It's like you don't have that like salary to rely on. That's going to happen no matter what, right? If my husband's patient doesn't pay him, he still gets his paycheck. Well, maybe now he was a steward doctor, so I don't know. It's like, I'm going to go there. But for me, I can do like 10 cases. And if the insurance doesn't pay me, or the patient has to pay me and can't afford it because they didn't know their deductible or what co-insurance, it's me, right? I got to pay my staff. It just falls on me. So those are the challenges. But I do think that, those, as in terms of surgery, yes, surgery is a brilliant field. We've made so much technology. Just my vein center alone, what I used to do in the operating room for 2 to 3 hours, I do in my office in 8 minutes with a much better result. And I don't even operate on your carotids. I give you statins. We have, our wound care is phenomenal. So we are able to salvage so many limbs and keep people walking and keep their legs with them without a lot of interventions that were very difficult for patients. Hours in the operating room, days in the ICU, and all those procedures now are really, technology has improved them incredibly. And that's one of the reasons why I wanted to disrupt healthcare, because I saw that we were changing how we take care of patients, and we still have this clunker of a system built in the 60s when everybody got admitted. And it's like, no, time out. We have to meet patients where they are. We have a new system, and we need to bring the technology of healthcare to match the technology of medicine. And that's what inspired UberDoc.
Yes. Great segue, by the way.
No, it just kind of happened. Well, no, I mean, it literally happened with a lot of angry letters, right?
UberDoc. Yes. That is, I dug into the website a little bit, but very, very cool. I like where you're going with this. So tell us about UberDoc and what brought you to this decision.
So I think, again, everyone always asks me, what was it? When you're an entrepreneur, you wake up with it sort of edgy. Now, my dad was an inventor. He was a great thoracic surgeon, had a lot of inventions. He modified a lot of things. He saw a problem. He said, I want to solve this. Very much like my son, the engineer. There's a problem I want to solve, right? My daughter, she sees a problem. She wants to create a fiction, right? An actor. She wants to, produce something. Again, it's solving problems, right? You want to create a work. So he was very passionate about making inventions and working with young people, and he would patent them, and then he'd sell them out to a company, and the company would manufacture it. So I was having an itch, right? I really felt that, being in the trenches, I could see so many of the trends happening ahead of my colleagues, right? Because I wasn't just getting a paycheck. I understood. And I used to see my patients struggle, right? All the time with their deductibles, their referrals or authorizations. I worked with a lot of inner city people with limited resources and limited access to, insurance and so forth. I witnessed the Obamacare, Romney care, Obamacare. I lived through all of that. Right. So I saw how it impacted patients and the flow of traffic and patient care. I saw the care. So seeing all of those, I'm like, wow, there's a big disconnect. I noticed it right away. Huge disconnect between being able to service a patient in a modern way and what the narrative is. Yeah. Oh my God, we need billions of dollars for this. It's like, but do we? We don't need billions of dollars. If a patient comes directly with a breast lump to a breast surgeon, you can put a needle in it, you can figure it out. right? Because I do a lot of women's health, a lot of breast work. And it's like, but no, let's have them come back and then come back again. And let's do one breast. Let's do the other breast. Because the sum of the parts is greater than the whole, because now you can generate 5 billable events.
Oh, no.
As opposed to 1. But it's like, but you have a patient with a lot of anxiety. You want to just nip it in the bud.
Yeah.
But nipping it in the bud is not, in some boardrooms, and I'm going to say like probably HBS boardrooms, they looked at that and said, recurring revenue model, you've got to bring them back 5 times, right? As opposed to understanding how patient care really happens. You take care of that patient efficiently, you can have 4 new patients in your waiting room the next day. And that's where all of the delays come from. That mentality of breaking patients into, I say, horcruxes, like multiple pieces.
Yeah.
Right?
It's not
it's opposed to just taking care of their problem.
Yeah, and it's not putting the patient first. It's putting the
company
first.
It's putting the billable event first.
Yeah.
Right.
Yeah.
You know.
Okay, so how's UberDoc going to fix this?
So I had thought, well, I want to just solve one problem.
Yeah.
Access. That's it.
Access?
I just want to make it easy. That's it. I didn't think that if a patient went to the emergency room and said, you know, you have a kidney stone, and they said, okay, now what do I do? You need a urologist. Okay, I don't have, go to your primary. I don't have one. That's a common discussion in emergency room. So it's like, okay, what could you do? If you could go online and find a urologist nearby, available, and make an appointment. Now, what stops you from doing that? Well, the system stops you at the door. Do you have the right insurance? Do you have the right referral? Do you have the right authorization? Do you have the right employer? Do you have the right money? Like, are you the right zodiac sign? Right? I mean, there's a million things that stop you, right? So how do you get rid of all that? You make it cash. But rather than make that price prohibitively high, you made that price just above Medicare for legality. Okay, so with our UberDoc model, what we were trying to do is solve that one problem. Find a doctor nearby, available, make an appointment. We're an appointment maker and a payment processor. But the payments are not through insurance. They're through direct pay with your credit card or health savings account. So in other words, the patient now is empowered to make that appointment and pay that. And the doctor is giving a transparent price. And the price is fair. It's not a super high price and it's not a super low price. It's a doctor price. And it's compatible and compliant with Medicare. So it's like a 1.25, 1.5 Medicare price.
Right.
What does that mean? It means that the patient can now go find a specialist nearby available, make an appointment, get an answer, get right in, priority access, and get it all paid. And the doctor is very happy because they're getting paid for that visit at the time of the visit. It sounds very simple and transactional, but it's completely opposite of how things happen now.
Yeah.
And then subsequent care could be through insurance. It could be through direct pay. You might not need anything else.
Right.
But now you've seen an expert, you've gotten your question answered. So rather than if you twist your ankle and you go to an urgent care and they may do some x-rays, which you're paying for, then you go to your primary, which you're paying for, and then they send you for more x-rays, which you're paying for, and then they send you to the orthopedic, which you're paying for. So now you've left work 5 times, right? And you haven't gotten your problem solved. Your ankle still hurts. What if you could just, instead of going to the urgent care, just walk into an ankle surgeon or an ankle specialist immediately and pay a transparent price? And that's what UberDoc does. It allows direct access to definitive care for a transparent price. And then we're only the first date. We're not a bundled care. We do have all our orthopedics will snap that picture of your wrist because they already have the tech employed. It costs them nothing. It probably costs them more to bill that x-ray.
Right.
They're going to get paid $12. They're going to pay $15 to bill it, right? So people who understand how billing occurs and collecting occurs are very happy to take payment up front to take care of you, because that means, so UberDoc was created for doctors to give me a seat in their waiting room, improve access, and a little bit of cash flow. 1 or 2 UberDoc patients a week can pay your front end, right? And it was created for patients to have convenience, accessibility to definitive care. Right. There's a lot of access points out there in digital health. You can talk to Talkspace, you can talk to MAs, you can talk to probably AI bots at this point. Right. There's a lot of unclear care out there. And I have to say UberDoc is an in-person, but you also have telemedicine as well. Doctors can be available both. Right. And so it's really about access and price transparency to definitive care.
And it's geographic too. So you're dealing with the patient in their geographic location.
Telemedicine allows us to go to the state borders, but we follow all of the
Right.
rules. You're only talking to someone licensed in the state. But really, most of our doctors are in person. Most of this is the orthopedic, or I need to have a breast lump, or I want a second opinion on something. I mean, that's who uses UberDoc, right? They
Right.
just want to get in. They, either because it's situational, they're traveling and they need to get seen. They're nervous. They want to just be, and now it's like everyone's paying so much to just go to their doctor with insurance. It's becoming like much more efficient and cheaper to not use your insurance.
Mm-hmm. And then
And
that,
it also, I believe that patients should have choice. I don't think your employer should decide where you should get your care. That I
absolutely,
find
yeah.
profoundly offensive, because it's an invasion of your privacy. And there's no reason why you have to drive 50 miles to see a doctor when that urologist might be like 2 miles away from your work.
Do you see insurance companies maybe becoming more flexible in this type of a model?
Oh, for sure. Insurance companies from the very beginning loved UberDoc. I got to tell you,
Right.
because we were tasked by CMS early on. They really liked our model to say, well, talk to the Medicare Advantage folks. We don't want our Medicare Advantage folks. So a lot of them said, they had such restricted networks. They liked UberDoc as a second choice because they knew the price was guaranteed. And in Medicare, it's really funny because for a Medicare patient, we're completely compliant. It's only $50. You pay $50 and then you can bill Medicare the rest. So
Wow.
it's just $50. So we always say we give patients the advantage for only $50.
Yeah, that's good.
In a Medicare Advantage model, it's like everything else. It's going to be the full price because it's like insurance. But it was interesting how CMS really wanted to encourage this model of choice, because it gave more access. At the end of the day, people just want to make sure that there's affordable access to qualified individuals. And that is the space UberDoc fills. And it's funny because our relationship with the government continues, because one of our biggest customers is actually, we manage appointments for the veterans, disabled, fit for duty.
Oh, perfect. Yeah.
Yeah. So people who understand, you really need to make appointments, and there's no really easy way to make an appointment for these folks.
Did you have resistance in the beginning? Like, was this when you started pitching this idea? Did you have setbacks? Like, oh, this isn't going to work, or I don't know.
When I started my doctor's lounge, right, and it was only for 6 core surgical specialties at the beginning, like the orthopedics, the ENTs, the
Right.
gynecologists. And I pitched them, it was like, oh yeah, sure, like we'll take a patient for cash, because a surgeon, a specialist, is thinking of a case, right?
Right.
I don't I learned this through my many years in my vein center. We do what we call free vein screens, right? I put an ad in the paper with ugly legs, and people come in and say, oh my gosh, I have restless leg. I didn't know. And that it was related to veins. And then it's like lords, like come from all over, right? And you solve their problem and they kiss you. So
Right.
it's like, this is great. So the concept of like jumping directly in front of the patient with care, direct to consumer medicine, I think is for sure. Doctors need to be front and center with their skill sets to the patient. You can't wait till it gets filtered through whatever the acceptable systems are and so forth. Because I do think there's a lot of creative innovation out there, and really and there's a lot of trust with doctors, right? I mean, again, qualified doctors, there's a lot of trust. So that's how, like, that's how we kind of built, the concept of, I didn't get any resistance among the doctors. The places I started to see resistance were actually the offices.
Oh.
Because now, an office manager is like, they're evangelists for insurance.
Right.
Like, I need your copay. I need your deductible. Go home unless, those big signs in the office. Do not even think of coming into the window until your insurance card has been, So there's been a lot of like front end people who are so used to taking insurance, they can't understand a patient who just wants to pay cash. And then what's happened recently is all the consolidation has produced centralized scheduling, which is the most impersonal way to deal with patients, so that the doctor in the front end who's dealing with the patients gets like the older patient who shows up on Tuesday, their appointment was supposed to be Thursday,
Oh,
and the office manager has no way of opening the window in Epic because the windows have been closed off to them because they are supposed to be central scheduling, which is now overseas.
what?
Right? It's not even, which is a whole issue with protecting patient data. And one of the biggest reasons data is hacked all the time is because these overseas central scheduling has been outsourced, and there's not a lot
Wow,
of
I did not
protections
know
there.
that.
Yeah, that's one of the biggest reasons why things get hacked, because unless you're under one roof, it's HIPAA. If you try to communicate, if I'm HIPAA and you're HIPAA, and I try to hand you something, the connection is not secure, right? It's not physically possible to secure HIPAA secure a connection.
Yeah.
So it's like the Houthi rebels, right, in the Gulf of Aden, right?
Yeah.
I mean, it's like you're
vulnerable.
So those are some of the challenges we've had in terms of implementation. The physicians have always been on board. The systems have been on board. And like I said, the insurance companies don't care. They're not paying. Anytime you go without insurance, they're perfectly happy. As long as they get their premium, they don't. And as long as they had, the Medicare Advantage folks were like, well, if they need surgery, do they still need approval? I said, oh, of course. If you're paying for it, you still follow the same rules.
Right. So when this rolled out, you started with just surgeons or just specific care, and then how did it expand from there? What did you do to grow?
Because doctors were like, why can't I be on this? Why can't I be on this? And then we realized it was actually the direct pay primary care doctors who have now really come to the forefront as the highest standard, best outcomes for medicine. Who said we want a bigger network, and we want to be part of it. So I just followed the lead, and then I decided at the very beginning we were a subscription model. So I pulled the subscription. I said any doctor can join that's qualified for free. We put a freemium model. It should just give me a seat in your waiting room. So now we have closing in on about 6,000 doctors that are joining the platform. People join every day, actually.
Amazing.
And it's just like my goal is to have a seat in everyone's waiting room. My dream was that you could walk into anywhere and see the UberDoc sign in the window, like it's like Discover card or something. It's like, oh, you're UberDoc. Oh, good. I'm gonna pay with my HSA. Right? You must, or I can make an appointment differently. Like the concept that becomes a cash price that's already negotiated, it's already predetermined. Because most of the time the front end doesn't know. Like, you look at my charge master, it's $500 to see Dr. Muto, but it's not really. That's the charge, which is like, inflated, and the actual price is somewhere buried in there.
Yeah.
So I think that helps, again, transparency and access are the mission.
So someone gets on the site, they find a type of doctor they need, they choose from the list, they submit it there. What's the turnaround? Like how quickly do they get an appointment?
Well, they can choose, like the doctors are ranked by, I think, proximity and availability. So Dr. 1 mile is ahead of Dr. 2 miles, but I think actually availability might be first. Dr. Monday is ahead of Dr. Tuesday. So they're ranked by availability and proximity. And then you just choose an appointment, and they're infinite appointments. If you go to the page, the doctors basically post 1 or 2 appointment slots, and they appear in infinitum. So it's kind of like house seats at a Broadway show.
Right.
So you can choose when. You could be seen as soon as tomorrow. You can't be seen the same day. We're not an emergency platform.
No. But so they make their payment, and then the office is notified of the appointment, and it's booked in.
The patient asks for it. They put in the chief complaint in their own words. There's no data.
Interesting. Wow.
They say my right thumb hurts. Right. Now, if you're a neurologist, you're like, I don't care. No, or gastroenterologist.
It hurts when I do this.
Like, okay, my right thumb hurts. So, okay, your hand surgeon, you say, okay. So the doctor just they get a ping, the office or the doctor gets a ping on their phone saying you have an appointment, and you just say thumbs up. That's it. Just thumbs up. That's all you say.
Wow.
You just make it quick and easy. And then immediately when that occurs, money is debited from the patient's account into the doctor's account, and an email is sent to the patient with date, time, and reminder. And then when the patient sees the doctor, they can dictate, they can put them in their into their record. They can dictate whatever they want, and then they just push a button, say appointment complete, and they get the other payment. So we don't integrate with electronic records purposely, because we don't want any, it's supposed to be that simple. We don't want any, we don't need any sort of complex data sharing or anything like
Right.
that. And if the patient doesn't show up and doesn't cancel, the doctor, they forfeit the $50. If the doctor has an emergency, cancels, the patient gets refunded. So it's very seamless, the appointment. So you get $50 to make the appointment, and then whatever the balance is, which is on the average about $200 for the appointment.
It sounds so simple.
It is incredibly
Like, why
simple.
is this? Why? So
Why isn't everybody using it, right? Well, we built the platform with a fourth grader involved. Like literally, we did it at the fourth grade level. We did not want it to be complicated.
user friendly. That's the whole concept,
a patient
right?
needed to see a doctor.
Yeah.
It needed to be simple, and doctors are inundated with a lot of complexity. It needed to be simple. And we have a lot of young, talented doctors out there who are sitting behind an army of Krabby Patties at the front desk. And all they want to do is I just trained. I'm so good at fixing your wrist. I'm so good at fixing your reflux. They just want to crack at you.
Yeah.
Right. They just want. And so we feel like the younger generation should be much more mobile, like on their cell phones, connecting directly to patients and in that appointment realm, not just, and I feel like what we talked about at the beginning, this isolation that we're 10 steps removed from our patients.
Yeah.
And we want to get rid of all that.
It almost could be back to the house call.
In some ways,
if the next generation wants to be as mobile as they like to be, right? Where they choose where they want to work and how they want to work. We could end up. This could take them back to the potential. Well, I'm in your neighborhood. I'll just stop by your house.
Well, remember how everything changed. So we started at pre-telemedicine, but I'll tell you a funny story. About a year into it, when we were building our network, Milton Chen, who is considered the father of modern telemedicine in the sense that he was the first one who figured out how to do video conferencing securely for the space station.
Yes.
Okay. Remember, video conferencing like this is no big deal, but if we're in an examining room, it's a big deal, right?
Yeah.
Like you can't let anybody just jump in.
No.
So he reached out and said, I really love your model, and I have telemedicine, and I want to put it in the hands of end users. And I'm like, what do you mean? He said, I want doctors and specialists to use telemedicine. And this was back in 2017, it was 2017. I said, Milton, what's a surgeon going to do with telemedicine? You're crazy, but whatever you want, you can have my specialty network. Oh my gosh. Then COVID happens and all of a sudden, so we started introducing telemedicine to our doctors as a way to connect.
Right.
I can have appointments in my office, but I can also have telemedicine. And it's very hard to collect co-pays with telemedicine. It's really hard to collect insurance cards with telemedicine, but you make it cash. It's easy as pie.
Yeah.
Right. And so there are some really great specialists out there who have telemedicine practices. We have one of them on our platform, Dr. Deanna Garnita, who's probably one of the best rheumatologists in the country, and she's the biggest expert on gout. And it's fantastic. She's not just licensed in one state, she's licensed in a number of states. So she can really help. There's 8 million people with gout. There's I think 3,000 or 4,000 rheumatologists. There's just not enough out there.
Right.
So to be able to take someone like that and allow her to connect with more people in a meaningful way, very much definitive care. And it's not the teledoc world, right? Those are one-off, very different. They're very, very different model, right? I have a UTI, I want to get a prescription for something, right? I have a rash, those are one-offs. Right? This is a little different. These are specialists. They may be a one-off, but they're a little bit different. UberDoc is a little different. We all sort of sit in the same sandbox a little bit, but we all do something a little bit different. And UberDoc's always been UberDoc, above everybody. That's why we use the name, for universal access to specialty, not the average doctor. And we don't have any mid-levels on our platform, although mid-levels are participating in our Hero Serve program to help with the vets. So.
I love that. I didn't make that connection, even though I'm a marketer. I didn't make that connection that UberDoc was also Uber as in best doc.
Well, that's why we used it.
But Uber also is now
it's another
association
brand and everything else. And like I said, and they want my trademark name, but I got trademarked. I mean, I have it.
Good.
They're challenged.
That's good. But it has that's got some perks to it too. Always some advantages.
What I defend my trademark because it really has nothing to do with transportation.
No,
and, there's a lot.
It's access. which is a form of, and when you can look at it, transportation, but it's accessibility.
Yeah, but so is Amazon, so is
Perfect.
Google. I mean, think about
Exactly.
it.
I
There's a
think it's
lot of things
great.
that
I think it's a
are.
great alignment. I think it's really neat. Um, when you were talking, we were talking earlier about building your team. So when you were building UberDoc, how did you build your team? Like it's a different beast of a business. So how did
Yes.
you build your team for this?
So when I started UberDoc, I put a bunch of people in a room, doctors, who had been entrepreneurs as well, and as well as managed care experts, local business people, mostly in healthcare.
Right.
Again, I put them all in a room and I said, I have this idea. What do you think? And they said, okay, that sounds good. Let's do it. And so that was my first check, was from one of the physician business people, a physician, it's still in practice, and who was like really dedicated to the concept. And then we needed to build the site, which was a platform, and that was really the most fun. The agile method was fantastic. They said I was really good at it because I'm a surgeon, so it was easy to make decisions, right? Good, bad, you had to make a decision to move forward.
Right.
So they went lightning pace, really economically, built a solid gold, platform that, knock on wood, has functioned beautifully. For
it's a beautiful
now
website.
8 years.
Yeah.
Right? 8 years, and it really runs beautifully because it was built really well. And we learned early on, and so we had a really good team, and that was actually somebody I played squash with, who was one of our early advisors, whose brother was a digital architect, was able to. So we had a wonderful team. We had a Ukrainian team briefly for a while that helped build the site, and then they unfortunately fell apart with the whole thing. We have a team now, developer from Brazil, who's fabulous. So we've been, God bless, our technology's been great. I had a co-founder, Brianna Sochi was a wonderful young person. She's off doing now, sort of moving on to bigger things or different things, and who was very interested in marketing and very enthusiastic, and was really, a very important member of the team, always there to build things, and then I have other members of my family actually that were participating. My COO was my niece's husband, and he came into it. So it was kind of a family affair. My sister-in-law was very instrumental in all of this because she was a marketing person. She was like the first CMO for Constant Contact, really understood how customers, and she had a startup of her own. And she sat with me in the Nordstrom's cafe with the back of a napkin, helping me wireframe what you needed to do to create a business model for this type of product. So I have to say I'm really blessed. And my brother is a doctor, of course, and I have another brother who's a computer expert, right? So, and he installs and was part of the whole electronic record implementation in offices. So he knew who we were dealing with, right? He knew the office staff. He knew, so he designed the whole interface to make it so bloody simple. I like to say anti-epic, so that it would be flawless, seamless, so that would be easily adopted. So we had all the right people in place. And over years, it has to do with funding, it has to do with resources, right? I mean, I bootstrapped this company. We recently got acquired by a company in Canada with plans to go public in the Canadian markets, and we have a new CEO who's phenomenal. So I'm like really excited because people have recognized that it's time for UberDoc to, it's time to not put baby in the corner.
Right.
Right.
So you're expanding now to this is country number 2. So you haven't.
Well, we're not expanding necessarily in Canada, right? It's just Canadian investors.
Oh,
Canadian investors who are there are a lot of Canadian investors who invest heavily in the American healthcare market. Right. So these are Canadian investors. We're an American company still. Canadian investors who've been working with us for 2 years are absolutely wonderful, really super supportive, really believe in our vision, and really believe in the company. And so we have been, so we went through, we moved into this next phase, which is super exciting, because, capital infusion and expansion, and to really, because we have a lot of work in front of us. We have a lot of appointments to book, and you need to have capital to be able to do that. As far as the consumer model, we love UberDoc, but it's very expensive to advertise the consumer. Very expensive. And we have been waiting in the wings. It's sort of interesting because a lot of people have spent a lot of money, and I'm just watching them. Right. We're the back end to a company called Sesame. They're a lovely people. They're trying to do direct pay healthcare, a little bit different, sort of lower end sort of appointments, but still they're in that space, and we work with them. And and if we, of course, everyone's followed always the teledoc and things like that, but direct to consumer, Roe and Roman there, and Hims and Hers. There's been some forays into the direct-to-consumer space, a little different than us. Again, not like they're very much more isolated to particular kinds of disease processes where we're just specialty care. We're kind of generalists. But a lot of money's put into consumer, and I don't think that nut's been cracked.
Right. So a faster uptake on the doctor side, not as quick an uptake on the consumer
But that's where
side.
I think we live, because the doctors are going to bring their patients.
Sure.
When the doctors convert. To direct pay, and they're close. And when the employers want the direct pay, right? Everyone just wants a price. Like, everyone's tired of the smoke and mirrors. And and again, we are system agnostic. We're not taking down Medicare or Medicaid. No. We're not telling you empty your waiting room and put in we're not a concierge model in the sense that you have to pay to see the doctor. You only have to pay for that seat. Right. That doctor takes those other insurances. You're just getting in.
Yeah. You're just getting in the door. Yeah.
Ultimately, I think all doctor visits should be cash. I think health savings accounts and health vouchers, Medicare savings accounts. EBT cards should be paying primaries. I think all the primary cares, all these wonderful doctors should just be paid in a transactional, immediate way.
Yeah.
And stop all these claims. The claims cost a lot of data, and they're really unnecessary.
Yeah, well, I think you found
save insurance for the big stuff.
Yeah, exactly. And I think you kind of found a way to balance you're using technology to balance out the human touch, right? Where you're actually getting people to their doctor using technology, and simplifying the process.
You just want a doctor and a patient in a room together. I can't tell you how many times in my career, like, somebody walks in and I can diagnose them in like 30 seconds. They're like, think I'm a genius. It's like, no, I've seen a million legs or a million breasts or whatever. It's like, I'm not a rocket science. It's just what I do all the time, right? And I think that we tend to wander in the desert, right? People go to Dr. Google and now ChatGPT and AI, and then they go to the urgent care, and then they go to the walk-in, and then they go, the primary care isn't there to see them, and they have, some very newly minted nurse practitioner who doesn't want to kill you. So, like, you have a headache, I think you need a CAT scan. You could have a brain tumor. It's like, well, no,
Well, it's like, I could see how this would be like, a parent with a child who's got something's wrong, and you either go sit in ER for 9 hours or 10 hours, or however long it takes to get through ER for something that may be significantly minor. But if they could see a doctor, quicker.
So I'll tell you, one of the things that some of the pushback we get sometimes is like, oh, first of all, they say, oh, my office is really efficient. We don't need that. Like, a lot of the orthopedics have consolidated and they have all sorts of fancy websites, but you try them, it's all the same, right? You're putting in information. There's still a human on the other side who has to process it. It's like, we take the human out of it. Right. It's like, we're just going right to that, you're literally just going right to the doctor to say thumbs up, right? You're giving the autonomy back to that physician-doctor relationship, right? So that's part of the sometimes some of the challenge that we see. And also we see, I'm so busy. I'm booked out for 6 months. It's like, yeah, that's why you'd sell your seat. Right. Because no one has a zero no-show rate. At the best, you have 4-5%, and average is 12 to 20%. Right. If patients just don't show up. And more patients don't show up now, because when you get your appointment, it's 6 months from now, right? And it's like, oh no, I don't know where I'm going to be in 6 months, but that's when your appointment is, right? And you sort of feel like, there's a lot of miscommunication, a lot of no-show. So I always joke with those doctors saying, well, you're like a Hamilton ticket. I said, people are going to, you're going to sell that. And maybe a general surgeon's more like cats. Maybe nobody wants to see me, right? But for some, like, for that special, like, dermatologist, it's like, you're going to be the top of the list. Yeah. So I think that for my purposes, it's very important for doctors to acknowledge direct pay. One of the challenges also is that insurance contracts oftentimes say it's a violation if you treat an insurance patient without their insurance card. But we get around that because the patients sign a special form, a HIPAA form, when they sign up for UberDoc. So it's the safe way to do direct pay. And it's pretty mindless. As you said, you were on the website. It's pretty mindless.
Pretty straightforward.
And there's no barrier to entry on the doctors. And again, a lot of doctors are consolidated, but that doesn't mean that they can't control these appointments themselves, right? You just have to figure out where that payment goes. Does it go to your institution? Does it go to your bank account? Whose bank account does it go to? But I honestly, it's the important thing is taking back medicine and put the doctors back in charge, because again, getting back to, medicine is very different than it used to be.
Yeah.
I don't admit you anymore. I don't keep you under my watchful gaze until you're perfectly healthy. I operate on you and kick you out.
Yeah.
And then it's your family that has to take care of you, right? And think about that. We don't fund any of that.
No.
Right?
No, absolutely.
It's the social determinants of health that determine the outcome. And we put $0 into that. Instead, we buy beds, we sell beds, right? And that, that's my own hospital was part of the Steward Network, and they sold beds. They created beds as a commodity, as a business model, right?
Yeah. And that does not put the patient first.
Well, I don't think it's a modern approach anymore.
No,
when
it's
you
outdated.
can sell beds all you want, but you won't fill them all.
No.
You can fill them all, but not economically, because when you're operating in your office, you're sending people home, you're managing people with telemedicine and remote monitoring and a little AI mixed in, you're preventing a lot of those things. And so that's where healthcare is. It's super fantastic, but it's delivered in a very different way. I mean, look at cancer. I mean, gosh, cancer used to be in the hospital, in the ICU, or in the cancer wards with infusion therapies, and now you're at home with a pill that was made just for you, with your genetic footprint on it.
Yeah, we've come a long way, and it's going to
come a long way.
It's just going to go at lightning speed as we move forward.
Right,
now.
And that's what I always imagine healthcare is like. Medicine is like a drag racer, and healthcare is the drag chute,
right.
Holding it back, right? Yeah. The business of healthcare.
That's a great analogy.
Back
yeah.
The race car going forward, right? Because and that's where the young people come in, because we need to turn this around for those talented young people that we're training, that are doing amazing innovation. And I think that, there's plenty of hope there's a lot. I'm a very hopeful person. I'm very optimistic. I think we just got to get around where we are. We got to get out of our own way. And I think that a little AI, a little Doge would help. Doge would go a long way here.
Thank you so much, Paula, for sharing your story with me and with our listeners. It's just been really interesting to hear your Uber adventure. Do you have anything you want to share to anyone sort of walking your path, but maybe
walking my path? So so I would say that first of all, anyone can contact me if they're people listening on this who are health benefit people, who work in hospitals, who think this is really great. Physicians out there, just contact me, paula@uber-docs.com. I mean, please, my contact info. I'm very happy to talk. Again, my goal is to get a seat in everybody's waiting room, right? I want every doctor to join. As far as walking the journey, I think that it is about the journey. It's not about the destination. I've met some fantastic people. I've learned a lot. About my own practice of medicine. I've learned a lot. I can listen to my patients a lot more because I understand what is going on. And I also respect my colleagues in a different way, because I'm not just in a silo of surgeons. I talk to everyone, right? The direct primary cares, the pediatricians, the neurologists, the rheumatologists, the orthopedic. It's like everybody's part of this family. I like to say it's not just a network of doctors. It's a family of really well-trained doctors who just want to do the right thing for their patients, right? They love what they do. They don't train 7, 10 plus years because they don't like it.
Right.
And so it's heartbreaking to me when you hear people getting delayed, people can't find anyone. I mean, rural hospitals closing, women can't deliver babies.
Yeah. Something's wrong
That's
there.
a heartbreak, because
Yeah.
there's lots of people out there who are really well trained who want to take care of patients. We're just in a mismatch.
Well, I think you found a solution towards fixing a lot of these problems. So congratulations on that. And I really look forward to see where UberDoc goes. And maybe we'll talk again and see where you are, 6 months or a year from now.
Yeah, it would be great. Yes.
Okay.
Very exciting time.
Well, excellent. Thank you again so much for being on this episode. And thanks to our listeners for listening in. Well, we've heard it before and we heard it again today that entrepreneurs love to find solutions to problems. And that's exactly what Dr. Paula Muto did. Was she found a way to get easier access for patients to doctors through UberDoc. And she's built a team of exceptional people in order to help her see her goal is to have UberDoc in every doctor's waiting room. So I wish her all the best of luck. And if you'd like to learn more about UberDoc, you can visit the website at uber-docs.com. And she's also invited you to connect with her on LinkedIn if you have further questions. Thank you for listening to another episode of The Healthy Enterprise. Stay healthy, and we'll see you soon.